And well, there are records, so I cannot say too much. But you are most welcome to join us for the annual meeting in Ho Chi Minh City, Vietnam, next year.
Yeah, definitely. Yeah, I missed the last meeting in Bangkok, but
Yes.
definitely come to Ho Chi
Hopefully,
Minh.
to see you in 2020. I guess it's 25 in Ho Chi Minh City. I think it will be in November.
Yeah, little bit cooler.
Yeah. Especially in Vietnam. It's a very nice city, Ho Chi Minh City.
Yeah. I went there many years ago,
Okay.
but haven't been there recently.
Okay. So, Dr. Guo, would you like to start?
Yeah. Hi, everyone. I'm Dr. Shen-Po from Sheng-Po Memorial Hospital in Taiwan. And we're really honored today to have Professor Sinha for today's speaker for Dr. Sheng-Po host webinar today. And I would like to introduce Dr. Sinha first. Professor Sinha graduated with distinction from the Calcutta University, India in 1985. He was invited by House Ear Institute and University of Southern California, where he started his research career in molecular biology of neuroscience and cancer. He then finished residencies in otolaryngology, head and neck surgery at USC, completed a clinical fellowship in microvascular and plastic reconstructive surgery in Mount Sinai Hospital, New York. He then went to Lyon, France to complete a clinical fellowship in laryngology. He continued to pursue academic career and subsequently he joined the faculty of the Department of Otolaryngology, Head and Neck Surgery at USC. Because of his academic achievements, leadership, teaching, and research, he became Chief and Residency Program Director for the department. His major area of research are head and neck cancer, thyroid cancer, plastic and reconstructive surgery, trauma, and speech and swallowing. Now let's welcome Professor Sinha.
Thank you. Thank you for a wonderful introduction. So I'll go ahead and share my screen.
Yes, please. That's good.
Can you see my screen?
Yes.
Yes.
Great. Thank you for this wonderful invitation. And some of my disclosure, these are my disclosure. And I use a lot of Google Photos, by the way. So I have to talk about Professor Howe and my personal reflection. I met many, probably a quarter of a century ago, Dr. Howe, in a international meeting. And my first, after our first meeting, I was so impressed with his talent and compassion and care. And not only that, not only he's a great surgeon, but also the other attributes. So for the first time I invited him was probably 2001. We used to have the USC International Head and Neck Cancer Conference, and Professor Howe and Dr. De Cruz, they came and I picked them up. They went to sleep. I had to hard time to wake them up because they had so much jet lag. So Dr. Howe's groundbreaking work in our field is well known. He is the world leader in head and neck surgery. And I really thank him for shaping the careers of countless surgeons. This is really important to create build the next generation head and neck surgeons. And he's a compassionate, caring, loving friend with a great sense of humor. And I always cherish our friendship. So thank you, Dr. Howe, and I congratulate you for your wonderful career. And so I thought maybe we'll talk about artificial intelligence because I'm working on it for the last probably 10, 15 years in our lab. So I thought maybe we'll talk about this because this is a very trendy subject now all over the world. So we talk about different, little bit about background of AI. We also talk about the history and technological transformation in healthcare industry. We'll talk about productivity paradox and impact of AI on health, AI and AI addiction and stress, mechanism of stress, and how to reduce stress. These are the areas I will touch upon. So as I mentioned that we are doing this in our lab for many years, mostly for liquid biopsy from identifying the microbiome or analyzing microbiomes from the saliva to circulating tumor DNA and CTC, and also this
When the sunlight
dynamic
strikes
MRI.
raindrops in the air, they act as a prism and form a rainbow.
There's so much data we generate that we really needed AI to analyze that data. That's why we are heavily involved into AI for the last many years. So what is AI? It's a simulation of human intelligence in machine. It involves creating algorithm and system that can mimic cognitive functions such as learning, problem solving, perception, and decision making. And AI enables machines to perform tasks that typically require human intelligence. So the machine learning is a subset of AI that focuses on the development of algorithms that allow computers to learn from data, make predictions or decisions without being explicitly programmed. Algorithms relatively learn patterns and relationships from the data, enables them to improve performance over time. And there are several types: supervised learning, unsupervised learning, reinforcement learning, neural network, and things like that. So what is supervised learning? So you describe, tell the machine that for grapes, you tell the machine is green, small, it's a bunch, it's a shape cylindrical, so it learns it's grape. Same way for apple, you tell it's red, it's big, and it's a rounded shape with a depression at the top. So it learns what is apple. So that's supervised learning. Then unsupervised learning, you give a basket of fruit like this, and because it learned and you can isolate the apple in one basket and mango in another basket, so it doesn't need supervision anymore. But reinforced machine learning is you give apple and then machine will think, what it is it mango? Then you tell the machine, no, it is not mango, it's apple. Then it learns, so output would be, so input would be apple and output would be also apple. Now in neural network is getting more and more complex. So it's called neural network because these nodes, which is shown here in circle, is actually called nodes. So they are layers of these nodes, and each layer is called perceptron. And perceptron is a single layer of neural network, and there could be X 1, 2, 3, 4, 5, 6. It depends on how complex the system is. And each node is connected to another node, and this is called weight. That how much input is going to give from this node from the orange node to the green node to the blue node, and then there could be multiple nodes giving the input to these blue nodes, and then blue node will give more input to the green nodes, and then there will be the final output. So just to give you an example, say for example, this node, this orange node has say random numbers, say give 160. Now the weight and this number has to be multiplied. Say you multiply it, give 0.35. So that will give you about 56. But this blue node is also getting another input from another node, which is 55, and it has weight for 0.2. So that will become, so 55 times 0.2 would be 11. So now the sum of this and this would be 67. So now that's how it works. So ultimately, this node is also getting affected by other nodes, and this is the total output is here. So that's how each layer of the neural network works. So there are many hit in a multi-layer perceptron. As the layers are increasing in layers and layers and layers, the complexity goes higher and higher and higher. So there are many hidden layers in a neural network, and it processes this information through multiple neurons or nodes, and returns the result using an output layer here. And deep learning develops algorithm that can be used to train complex data, and what's the meaning of all these for us? It can cause cancer diagnosis from maybe saliva or some histology. It can read the EKG. It can do EEG analysis, cardiovascular modeling, diagnosis, biochemical analysis, things like that. So in summary, AI helps automate intellectual tasks that are typically performed by human, is the first generation. Next came the machine learning. Machine learning is a set of artificial intelligence method that keeps the learning from new data and helps predict the future. And deep learning and neural network is the method that learn by themselves and make decisions of their own, and it improves over time. So if you look at the history, it's nothing. AI is not new. It was 1950 when Turing test was developed, and in 1955, the artificial intelligence the term artificial intelligence was coined by John McCarthy. And since then, there have been several iterations of the AI. And as you recall, in 2011, iPhone introduced Siri, and the same year, Watson won $1 million playing Jeopardy, one of the popular games in the United States. 2014, Alexa was introduced by Amazon, and last year, ChatGPT-4 was introduced by OpenAI. Now, all these things very trendy and very smooth, but actually there has been a lot of AI winter. There's a period when the interest and the funding in the field really went down. And that was in 60s. Another AI winter was in 70s. And people thought it's not going to work, because only if it is 50% of the time is correct, 50% is not good enough. It has to be close to 100%. So but recently, since 2010 onwards, there have been another AI boom, and that advanced so much into machine learning and deep learning. Now, so what's the next phase? It will be generative AI. So generative AI is a next step in artificial intelligence. It can learn human language, programming, etc. There will be drug discovery and research. Really, it will be very helpful. And it creates, for example, new protein sequencing with specific properties for designing antibodies, enzymes, vaccine, gene therapy, things like that. It also simulates clinical trial, especially for when we don't have too many patients, but it can create an artificial patient pool and can conduct a clinical trial. Also, it can democratization of AI. We can all use AI like ChatGPT today. And just to give you an example, I was talking to my phone and the ChatGPT about today's lecture. If I say, what else can I say about Professor Sheng-Po Hao's retirement lecture?
Certainly. When discussing Professor Sheng-Po Hao's retirement lecture, consider these points. Career highlights. Reflect on his impactful career, major achievements, and contributions to the field. Mention any groundbreaking research or innovations. Inspirational journey. Share anecdotes about his professional growth, challenges overcome, and how he inspired others. Highlight moments that resonate with the audience. Colleague appreciation. Acknowledge the collaborative spirit he fostered among colleagues. Express gratitude for his mentorship and camaraderie. Legacy and future. Discuss how his work will continue to shape the field even after retirement. Encourage attendees to carry forward his legacy. Remember, this is a celebration of a remarkable career, so infuse warmth and admiration into your words. Remember, this is a celebration of a remarkable career, so infuse warmth and admiration into your words.
Okay. So I hope I added a lot of warmth and admiration for Professor Hao. Anyway, so that's where we are today in generative AI. And I just said, what else can I say in Professor Hao's retirement? And he's giving me all these data. Anyway, so but not everything is as cool as it should be or as easy as it should be. There is always optimism versus skepticism. So promising technology initially fails, like every other technology. Early version of many technologies are flawed. And overcoming the paradox relates to the processes, structure, and culture of the workplace, which is very important. Like I think in 50s or so, when they came up with, or before that, when they came up with the newer machine, electric machine versus mechanical machine, they had to change all the culture of the entire work area so that it will be more productive. That electrical machine will run a lot of other electricity will run a lot of machine at the same time as opposed to one machine at a time. So that's the example of productivity paradox. So it's a three dimension. It's the role of technology, the need for a new approach to work, how we work, and importance of human capital. We must not ignore this, the importance of human capital. So these three go hand in hand, and to improve the productivity by using AI, we have to think through all these areas. So there are several questions for generative AI. Is there something about Gen AI compared to the previous technology that will hasten iterative improvements in the technology? Is there something about intersection of Gen AI and the current healthcare ecosystem that will accelerate the development of complementary skills and processes? So these are the questions that we should ask, and we do ask those questions. So if you remember that in 2008, we started electronic health record in this country. And it became, the Congress passed the law in 2008. It's called High-Tech Act. So in 2009, there's a very few, maybe 1 out of 10 hospital or clinic had electronic health record. But then government incentivized all the doctors and the hospital. And suddenly after a decade, there has been exponential rise into electronic health record in the hospital and the clinic. And when there was 1 out of 10 now had EHR, and now 1 out of 10 don't have EHR. It's very, very interesting to see that there has been complete shift in the whole program. So now there are almost not a single hospital or single hospital or clinic in United States which doesn't have EHR. But the evidence of did that improve the productivity? Our feelings are mixed. There has been definitely a lot of improvement. For example, reduction in medical errors and multiple other benefits. But at the same time, there has been increased dissatisfaction and burnout for clinicians because we are more busy writing notes on our computer as opposed to have a eye-to-eye contact with the patients or listening to the patient, and patients feel that they are not heard. So that's the dichotomy, and so we need to figure that out. And the other challenge there are many challenges in healthcare. It's not like other industry. Health industry is very, very different because it's extremely regulated. The market for EHR is highly concentrated. There are too many players. And also there are numbers of people who are involved in healthcare business. For example, physicians, hospital, health plans, employers, pharmaceutical companies, device manufacturing, and of course the government. And next is healthcare data is very messy. It's not clean cut like the way we can produce data in the physics lab. It's not like that. Healthcare field is very dynamic, is always changing. And fail fast and iterate is not an option in healthcare. For example, if you write an algorithm for, say, cell phone or any other program, or it can fail, but you can correct that right away and come up with another version. But think about this: when you are dealing with life, if it fails, it may kill the patient. So this approach is not applicable to healthcare. So fail fast and iterate doesn't apply to healthcare. So what's how we can improve the productivity paradox in healthcare? So as we saw, the Gen AI can be software should be user-friendly, and it should be compatible with our other big system like Cerner or Epic. And now there are EHR vendors who own a real estate, and these are the two big players in United States, Epic and Cerner. So we need some small companies who can bridge the gap between these big players versus how we can create a program. For example, if I see a patient in the clinic and I don't know how we take a history, we do physical exam, we do a scan, we do blood tests, but we really would not know what's the risk of doing say, resection and microvascular free flap in that patient with so much comorbidities. I wish there would be a program where they can anticipate what are the chances of complication. Then you can have open discussion with the patient. So I think those are the areas we need to improve. And the other area we need to improve would be, so I'll talk that in a minute, social determinants of health. So the impact so far has been really amazing. The in medical imaging, there has been tremendous improvement. So is in like in radiology or pathology. There has been improvement in, there could be applicable in drug discovery. It will help us in determining precision medicine. Then we are doing telemedicine, remote monitoring would be helpful. And there could be better flow in the operating room or ICU or the ward. Insurance authorization is always a challenge. So that would be, there is a tremendous opportunity to improve that. Then taking notes, AI scribe. When I'm talking to the patient, I can talk and the AI should, my laptop or my cell phone, I don't have to type. It should pick up our conversation and write a clinical note that will go into the EHR. So should reduce error. And healthcare robotics, as you can see here, how healthcare robotics, how the robotics are becoming more and more intelligent. In fact, when I do surgery now, they can learn, the machine can learn my movement of my fingers during robotic surgery. And then I don't have to move my fingers. The machine is going to move my fingers. Of course, I can override if there's any problem, but usually the robot is now moving my fingers as opposed to I'm moving the fingers. And this is the one I was talking about, that there are so many social determinants of health that we never captured during our during our history taking or evaluation of the patient. For example, what their educational level, where do they live, how much do they earn, what kind of job they do, how many kids they have, how many dependents they have at home. All those things affect our health, but we never capture these data. And I think the AI if we use AI, we can capture these social determinants of health and how we can translate that into our decision making in terms of care. So what would be the negative impact? Of course, nothing is 100%. So there will be fear of job displacement. There could be algorithm bias. For example, you have algorithm that may cause more unequal or inaccurate treatment, recommendation for some demographic groups, especially those who are vulnerable. And it can increase also the disparities, like disparities in healthcare, which already exist, and hopefully it's not increased. This algorithm is not going to increase the disparities more. Data privacy security risk is always there, vulnerable to breaches leading to privacy violation, potential misuse of personal health information, and over-reliance of AI, which will decrease our critical thinking skills and clinical judgment, and errors in technology is not used appropriately. Just to give an example, nowadays, before I could remember all my family and friends' cell phone number, but now everything is here. I don't even remember my wife's cell phone number. Then when you go to from here to another place, we are always using GPS. So I don't know the name of the streets anymore because they're always telling me make right, make in 400 feet, make right, make left, things like that. So I'm too dependent on GPS to go from point A to point B. There are ethical concerns, patient consent for data use, transparency in algorithm for decision making, accountability in AI-generated recommendation, and complex decision making with moral implications. So these are the challenges. These are the ethical concerns. And of course, loss of human connection is there. Telemedicine and AI chatbots really make a huge distance between I have hard time to assess or counsel about the psychosocial health when you are talking through a machine. And that may impact patients' satisfaction and the quality of care. Then the other thing is patients there could be loneliness and increased stress. It also enhances sedentary lifestyle, affecting health of physical and mental body. And lastly, AI addiction. So AI addiction is basically dependency. We are very dependent. We cannot do anything without AI assistant. As I gave you example, driving car, and remembering the cell phone numbers of family or friends, then we tend to escape from our daily living, interacting with other people. We can feel more comfortable when we are alone. And that's why if you go inside the elevator and nobody's talking to anybody, everybody is looking at their phone and going into isolation. And that social isolation will have detrimental effect on the mental health and overall well-being. In fact, this interpersonal communication skill is going down, as you probably have noticed among younger generations, especially. Neuroplasticity is also be a concern because if you don't stimulate the brain, and if a machine is doing all things for you, then neuroplasticity will also go down and makes behavior habitual. And of course, we're talking about this ethical concern over and over again. And programmer, a lot of them have neuroscience background, so they know all the neurotransmitter and the hormones in our brain or that affect our brain. So these the program developer, they should be aware of this, that how it's going to affect our lives, and also policymaker. And they should be very ethical in terms of making this program, so we are not completely dependent on the AI, or there will be less negative impact on our life. So AI causing a lot of stress. Why? Because you remember this nucleus here at the brainstem, locus coeruleus, and it has a projection to the entire cortex. You can see here. So the locus coeruleus is here in the white area right there, and in the green you can see the projection. The entire system is driven by the catecholamines, adrenaline and noradrenaline, which are the stress hormones or stress neurotransmitter rather. So this area produces a lot of catecholamines, and that produces stress, and that stress is has a lot of negative impact in our body. Just to give an example, it activates the hypothalamic pituitary adrenal axis, and that produces a lot of steroid, which causes immunosuppression. It also activates the catecholamines, activates the p53 genes, and it upregulates the orphan 1 genes that will cause metastasis. And lastly, the beta-adrenergic receptors are there on the endothelial cells, and they also induce angiogenesis. And also, lastly, there's an inflammation in the whole body, and it produces pro-inflammatory cytokines, and it enhances inflammation in the entire body. So all these negative things happening through the locus coeruleus. So what can you do? One option would be to do respiratory retraining, like how to reduce the catecholamines and corticosteroid in our body. And why it's important? Because if you look at the brainstem, sorry, my slides are automatic here on timer, seems like. The locus coeruleus and the pre-Böttinger complex is here. And so from a side view, you can see the projection. Now you can reduce the catecholamines by taking less breath per minute. And we knew this is a 1,000-year-old wisdom, that it reduces stress and make us calm, make us much calmer. But now the neuroscientists in Stanford, they figured out that how it works. So it reduces, by working through pre-Böttinger complex, it reduces the total catecholamines in the whole system, and that reduces stress, including and also reduces blood pressure and heart rate and respiratory rate, things like that. So there is a way to reduce stress, and I think we should hang on to that and practice that in our daily life as we are using more and more AI. So again, we have to incorporate AI in our daily living, but we must not forget these things. We must do exercise, keep smiling, have good food, do some mindful exercise, and sleep like a baby. And if you do those things, so AI is not going to have much less negative impact, which we can show from your saliva, looking at the DNA methylation, that there will be less chance of hypermethylation, and you live a good life. So we need to acknowledge, I have to acknowledge all my colleagues, and it's all about our patients, so who are the cancer survivor. And we talk about AI and food and sleep and stress reduction, all those things every Saturday, first Saturday of the month. And when we came back after COVID, one of our cancer survivor, Professor Richard Smith, he is the professor of School of Music. He is performing, and of course they're using AI to improve their performance. So I'll stop here, and thank you very much. And it has been really an honor and pleasure to give this talk, especially on Professor Howe's retirement. And I cannot stress enough what a wonderful human being he is, not only a great surgeon and the world leader. Thank you again. I'll be happy to answer any question.
Thank you, Professor Sinha. Now let's open to the floor. Is there any question from the audience? Okay, no, I have two questions, and I'm really impressed by today's lecture. It's really inspiring. And actually, when I first saw that you give us the topic about AI, I'm really excited. I don't know, Professor Sinha know that AI is recently really popular in Taiwan because of the CEO of NVIDIA, Jensen Huang. He just came to Taiwan 2 weeks ago, and it really provoked big attraction in Taiwan's media. And but when people talk about this, they more concerned about the stocks and how much money they can earn from this new technique. But for me, I'm more worried about maybe just like what you say, maybe we can be displaced by AI in the future. That can be a question, and I'm really interested in, because you're saying that when you're doing surgery and the robot may simulate what you're going to do next. And I'm quite interested in how do you feel that we in the surgical part, it is going to develop in the future because of AI. Because in my limited imagination, AI is more in data part, in paperwork part, but how about in the surgical part? What is it going to develop in the future with AI? And the second question is that how do you think that we can prepare ourselves to keep on with this new technique and without being, troubled or substituted by this new technique? Yeah, thank you.
Sure. Thanks for all the questions. So going backwards, so the robots, although it's moving my fingers because it's learning as I'm moving my fingers within the console, it learns how I move my fingers. It learns, and then for the next case, it will move my fingers without I'm moving my fingers. But having said so, I have to be very vigilant because I cannot depend on them, because it can go in some direction, say where the carotid artery is. So I can always override that. So we cannot, it's like say a little bit like the self-driving car, they're still having a lot of accidents. So we cannot just depend on 100%. So especially when you are doing surgery, when patient's life is in your hand, it's not that you will be responsible, not the intuitive who's making the machine. So it is in the end between you and the patient. So we have to be 100% vigilant, and we should take advantage of this, and we can reduce our, how would I say, our maybe physical work, but our mental work is not going to go away. So we have to be very vigilant on that. And I don't feel that AI is going to replace the doctors or the clinician or technician, because in the end, it's a machine, and it's an intelligent machine, but our human intelligence is limitless. The sky is the limit, so it will never be smarter than us. They can learn some technique and things like that. They can beat you in chess game, but ultimately it's developed by humans. So this neural network will always be inferior than human neural network, and it's never be smarter than us. But it's very good. Like as we heard that I was talking about what should I talk about, Professor Howe's retirement party. She told me a lot of things which I already mentioned. So there's a almost like a confirmation, but she cannot replace my personal emotion, my love, my respect for Professor Hao. It's just a machine. So how can it replace that emotional component of my emotion about Professor Hao? So those are the things it cannot replace. So we should be smart how we can use AI to reduce the cost of care. There are a lot of waste in medicine, and probably trillions of dollars we waste every year in healthcare industry. Maybe we should smartly use AI to reduce cost of care, so that we can save money instead of spending more money. So by saving money, we can have better more money in the system, so that we can utilize that to advance science and medicine through research. So those would be my thoughts in terms of AI and your questions. Hopefully, I answer your questions.
Yes, thank you. Okay, is there any question from the floor? So, Professor Sheng-Po.
Yes. So thank you, Dr. Go, for your moderating this section. And Uttam, I really love to thank you for supporting me and supporting us again and again. And I especially admire you. You always give us a very provoking, inspiring, future direction and really cutting edge knowledge. And although your talk has been very, very broad spectrum, however, you look into some of the important issues and with very simple examples, which make us really could understand easily. And especially, I love one of your slides. I think that slide saying help from a desperate wife. And and I could recognize the lady who holds the help. That seems to be someone familiar to me, and well, it's something like, a desperate wife. Help.
You recognize her.
I recognize that. Well, thank you. Yes, it has been wonderful, and to be your friend and to have your support, and always good to have you support us and share your knowledge, and it has been we're really wonderful, and I hope we could next time we should sleep together with Anina again.
Right.
Yeah. Very good. Yeah.
Thank
And
you.
so thank you for your lecture. It's really wonderful, and I hope you have a good night. And I'm going to announce some of the future meeting. So 2 weeks later, we are going to have a lecture by Dr. Jenny Amelo. She was my past fellow several years ago, and she went back to Philippines and had a great career. And she is going to share with us the surgical management of benign cervical tumor. So I hope all the participants could log in 2 weeks later again and to listen to Dr. Jennifer Aminor's lecture. And so at the end of this, morning talk, I would love to thank all the participants who joined us for this, lecture today. And of course, my deepest gratitude to Professor Uttam Sinha for his wonderful lecture. And I hope you have a very good night. And thank you for your time and your, lecture. Thank you.
Thank you.
Bye-bye.
I appreciate it, everybody. Bye-bye.
Okay, bye-bye.